In today's video, I want to talk about adhesive capsulitis, otherwise known as frozen shoulder. Adhesive capsulitis is a condition where scar tissue builds up in the shoulder, causing it to become stiff and painful. Now, sometimes this happens as a result of an injury, sometimes after surgery, for example, after a rotator cuff repair, but more often it's what we call idiopathic. It just kind of comes out of nowhere. Now, this condition pretty reliably progresses through 3 stages. The first stage we call the freezing stage. Now, in this stage, range of motion is going down, pain is going up. And generally, folks in this stage are in a lot of pain. Now, left untreated, this can last up to 6 months. The next stage we call the frozen stage. So at this point, pain isn't so much of an issue, and sometimes patients are almost pain-free, but their shoulder is really stiff. Their range of motion has bottomed out. They have difficulty doing all kinds of normal daily stuff, like reaching into overhead cupboards, reaching behind their back to tuck in a shirt is all really difficult. Now, left untreated, this can last up to a year. The last stage, the thawing stage, also lasts up to a year, and at this point, the shoulder just very gradually starts to loosen up, okay? So, left untreated, you're looking at 2, maybe 3 years of treatment, and this is where PT comes in. PT can really shorten that time frame. Now, what I like to do with my patients is cater their program to whichever stage they're in. As you might imagine, the person who's in that freezing stage, they're in a lot of pain, they're not going to be able to stretch as much, do as much exercise, do as intense exercise as that person who's in a later stage. So what I want to do in today's video is show you the home exercises I most often give my patients who are in that freezing stage. Our first stretch is shoulder external rotation. So in this example, my left shoulder is the hurt side. So you'll need a stick of some kind. I like to use the bat. You can use a broom handle. A golf club works great. So on the hurt side, we're going to keep the elbow in about 90 degrees of bending, and we're simply going to push the hand outward into external rotation of the shoulder. So pretty much push as far as you can without severe pain and hold for about 15 seconds. Now, one thing we want to do with all of the exercises is strike a balance between stretching enough to gain some movement, but not causing severe pain, not making the condition worse. So again, it shouldn't be severe pain that you feel with any of these. Some pain is probably inevitable, but it should be mild to moderate, and it should go away when you stop the exercise. So again, each stretch, hold for about 15 seconds. We'll do 5 repetitions. The next stretch is into shoulder abduction, which just means reaching out to the side. So again, in this example, my left shoulder is the hurt shoulder. We're still using some kind of a stick. In this case, I'm using my bat. Again, a golf club, a broom handle work great. And you're simply going to use your other hand to push the hurt side up and out until you feel some stretch, mild, maybe moderate pain. Again, don't push to the point where you feel severe pain. We don't want the cure to be worse than the disease. And what seems to really help at this stage anyway is not so much intensity of stretch, but frequency. Do this program multiple times per day. You'll get farther with more repetition rather than more intensity. So again, we'll do each stretch for a hold of about 15 seconds. We'll do 5 repetitions. Our last stretch is a chair step back. So again, my hurt shoulder is my left side. I'm holding onto the back of a chair, and I'm simply going to step back with choppy steps until I feel some stretch in that left shoulder. Again, I'm going to hold for about 15 seconds, and then I simply come back up to a standing position. Now, a couple little things. Try to keep your weight on your feet rather than on your hands. That'll allow you to get more stretch with less pain. And again, as I keep saying, we don't want to stretch so intensely that you have lasting or progressing pain with the program. You stop the stretch, the pain should essentially go away, okay? Again, stretch back. I get a stretch in that left side. I hold for 15 seconds, and we'll do 5 repetitions. And again, as I mentioned before, multiple sessions per day is helpful. More frequency seems to be more beneficial in this freezing stage rather than more intensity, okay? Again, step back, hold, 15 seconds, and that's all there is to it. That's my frozen shoulder freezing stage home exercise program. that I most often give to my patients. I hope you found this video helpful. I hope it helps you get back to what you love to do. Again, like, subscribe, leave a comment. All of that interaction really helps grow the channel, and we'll see you in the next video.